Welcome back. Now, the United Nations has warned that the fuel shortage in Gaza has reached critical levels. Fuel has become the backbone of survival in Gaza, of course, powering hospitals, water systems, sanitation networks, ambulances, and every aspect of the humanitarian operations. Now, without this fuel, the lifelines will vanish for the 2.1 million people that are living in the enclave. Joining me now, I'd like to welcome the spokesperson for the World Health Organization, Tarik Jasarevic, who joins us from Geneva in Switzerland. Tarik, thank you so much for joining us here on News in Focus on Hilaal TV.
Thank you very much.
Yeah, Tarik, of course, we see the current situation spiraling out of control, but especially when it comes to the lack of fuel, the fact that we've got, of course, the border gates that have been closed by the Israeli army. On the ground, just how difficult has work been for the World Health Organization to go ahead and power up, especially hospitals, and the dire straits that some of these medical facilities are going through?
Well, as you have said, fuel is vital for different aspects of life in Gaza, not only for hospitals, but also for desalination of water, so people can have access to clean water, for bakeries, for a communication system, for everything. This fuel is crucial, and there was almost zero fuel that came in since March this year. When it comes specifically to hospitals, hospitals need electricity. Ambulances need fuel to move around, and we need electricity in hospitals, not only to treat patients and to have light, but also to keep incubators, to keep machines in intensive care unit, dialysis machines, and everything that is needed to provide health services. So we need that fuel in immediately. But beyond that, the situation is so bad that it's really difficult to decide where to start when explaining how bad is life right now from the health perspective for people in Gaza. People are being injured in relentless bombing daily. Hospitals are struggling to keep up with the number of wounded people. People need to be evacuated to receive medical care outside, and it is not happening. People with chronic diseases cannot get care they need, pregnant women, and not to speak about most vulnerable like children who are hungry and don't have enough of food. So the situation is horrible, and we need not only fuel, what we need is really sustained and unhindered access, so we as humanitarians can do our part of the job and help health workers of Gaza. And above all, we need this horror to stop by having a ceasefire.
A few weeks ago, Tarik, I'd spoken to Abir Tefa, who's part of the World Food Program, I beg your pardon, and malnutrition was brought up. Just reading these reports, it seems that malnutrition is slowly starting to affect so many of the children within Gaza, and without any food and without proper care for these hospitals, this is going to exacerbate quite harshly.
Exactly. We are seeing more children being malnourished. Just today, our colleagues from UNRWA were talking about findings from their clinics where they speak about increased number of children with a severe or moderate malnutrition. And obviously, malnutrition in children makes their immune system weaker, and they are more likely to get different sort of diseases, especially infectious diseases. Unfortunately, malnutrition goes very well with the health status, and we need really that food to get in so children can recover and can try to lead a normal life. If malnutrition, even moderate malnutrition, persists for a long period of time, that can have a lifelong consequences. Again, we need food, we need fuel, we need everything, but above all, we need this bombing to stop, because other than that, unless there is a ceasefire, we will see more people being injured, more children being malnourished, more deaths from all different sort of health threats, and it's just difficult for us as humanitarians to watch the situation, and it's frustrating that we cannot do more while we have fuel and we have all the other supplies just minutes away from people of Gaza.
Tarik, the hospitals themselves, I mean, they to the bearers of bones. Al Nasser it's slowly starting to really self-destroy because of the continuous bombing from Israel, but also the fact that there isn't enough fuel that is being allowed to power those hospitals. What is your colleagues on the ground in Gaza saying with regards to this, given that medical personnel have had their lives also not just threatened, but also at the same time put in a difficult position so that they could not do their work, given that there's a lack of especially fuel, but also medical equipment for them?
The situation is beyond catastrophic. So there are no more functional general hospitals in the north of Gaza, nor in a Gaza city. Those hospitals that are still providing some sort of health services are lacking fuel. They are lacking also medical supplies for medicines. The stocks have run out. You mentioned the health workers. 1,400 medical workers have been killed, according to the Ministry of Health. Several hundreds of them are being detained. Health workers are doing their best. They try as soon as they have opportunity to go back and to restore some services, while at the same time they are under displacement orders. And we want to support them. We would love to be able to bring them supplies, to bring them foreign medical teams, and some of those teams are inside Gaza and they are doing their best to provide health services. But many foreign medical teams have been denied entry. So we do what we can, and we would like to do more. But again, we go back to the main point, and that's as long as the violence continue, as bombardment continue, unfortunately, we will see more casualties.
One final question, Tarik. WHO, OCHA, the World Food Programme, do you feel that this statement and this continuous dialogue that you and I are having is going to do enough to force the hand of a potential ceasefire to occur, even though negotiations are still on? The situation on the ground continues to get worse by the day.
Well, unfortunately, we have seen since October 2023 that all our appeals to stop the violence have not helped achieve that goal. What we can do as humanitarians is the witness situation. As you know, there are no international journalists allowed to cover what is happening in Gaza. We try to say to the world and show the images of what is happening there. But again, the decision is political, and it's not with the UN agencies. We hope that what we are reporting on and what we are showing will bring some sort of impetus to get to this political decision.
Tarik Jasarevic, thank you so much for joining us here on News in Focus on Hilaal TV.
Thank you.
That's Tarik Jasarevic, the spokesperson for the World Health Organization. Well, that's all we have for you here on News in Focus. Tomorrow is Talking Point from myself, for Hospital, and the rest of the team in Johannesburg. Assalamu alaikum wa rahmatullahi wa barakatuh.